Hello and welcome to my channel. This is Dr. Dawn Michael. Today's topic is going to be very interesting, and it's something that I have been asked to go over by many people for at least over a year now. But I've really wanted to gather all of my information and talk about it from a perspective that I think many people are not talking about, and that is this idea of transsexual, transgender, involving children. And I really do want to touch upon this because I see it as something that is basically snowballing, getting out of control, and I want to bring you my feelings about it, my professional opinion, and what I have seen and uncovered. Now, I will say that I have worked with people in the past that have been going through transition, and so I'm well aware of the struggles that people have, and a lot of it is very difficult, but I think it has been made 10 times worse by it being politicized. 10 years ago when I started working with people, it was not politicized the way it is today, and I think that it's turned into something else, and I don't think that it is healthy for the people who are dealing with it, nor do I think it's healthy for the public. And so the part that is really unhealthy is this idea of bringing children into it. And I will say that before a child goes through puberty, there really is nothing sexual there. They don't really understand their sexuality. They may have certain feelings. They could even want to dress up in the opposite sex, but they don't fully understand what it is because they're not sexual beings yet. They're still children, or have they experienced that? Even after puberty, and this is an important part because hormones really do change the way that people think. So you could have somebody before puberty that maybe thought one way, but after puberty and several years after puberty, the hormones will change the way that they feel about things, the way that they think about things, what they're aroused to, what turns them on. And so all of this can be very confusing if they were taught or they were told that they should just assume a particular gender, or even some of the stuff where they're instigating some type of surgery or delaying a child from naturally going through the process of puberty. All of this is detrimental because a person does not know who they are until they've gone through puberty and until they've lived in their body for a long period of time. And even people in their 20s are still discovering who they are as a person. So changing from one gender or one sex to another sex physically, there's also a mental aspect of this, a spiritual aspect of this, hormones involved. It's just a very big process, and it's not something to jump into. And in fact, people that I've worked with over the years, they can go back and forth. So whether they're taking hormones or not, at the end of the day, they're still not doing the surgery, which truly can be problematic. If a person really gets to that point, they're going to be removing a part of their body. And this part to me is very controversial because once you do that, you've transformed your body and you're not comfortable with the body that you were born with, to the point where you are literally chopping parts of it off, whether it be a breast or penis. If you were to say to somebody, oh, it's okay if we remove a hand, or if someone says, I just don't like my toes, or I think I want to remove, my nose, all of this would seem really insane. So to jump to the conclusion that you're going to remove part of somebody's body and change it, that's not something that should be taken lightly. A person really needs to be in therapy for a very long time to make sure that that is truly what's going on with them and it's not something else. because there's arousal confusion. There's issues that people deal with in childhood, where some people even have some abuse issues, where that can make them not feel good about themselves. And it doesn't even have to be a physical abuse, it could be a mental abuse. There's so many things that can be going on that will alter somebody's idea of how they feel about themselves. But getting back to children, this idea that children really understand who they are, or they would even know that they want to be one gender or the other gender, and then a parent getting involved in taking them to the doctor to either have surgery or to stop them from going through puberty, there's something very wrong with that. And I don't think that people really understand the magnitude of that, because this child needs to be protected by their parents so that they can experience life before altering their body or not going through the natural process. And the other part that is disturbing is these children that are coming on camera that, okay, they want to dress up, that's one thing, but then while they're dressed up, they are acting sexual. They are doing sexual things. For instance, a boy dressing up like a girl that is then dancing sexually, or going to a strip club, or going to Pride Week. None of this is healthy for that child, because they are displaying themselves as a sexual being. And that really does cross the line as far as, for the child's own safety, for how the child will think about themselves, and to have other people, grown adults, wanting to partake in this. It really does cross the line of what is going on here. This is not acceptable. This is not okay. We don't flaunt children around as somebody's sex toy, or something that can be looked at or played around with. This is all very unhealthy for the child, and it is not acceptable. The other thing is this idea of bringing it into the school system, or having a transgender dressed up and going to the library and reading books. All of this is a doorway into somebody who is interested in children sexually. And we really, as parents and as responsible adults, need to be aware that people do that. I know, because I'm in the field of sexual health, and I have worked with the other end of the spectrum, and I know that people have issues with being attracted to children. This is exactly the place that they would enter. And so we do have to be aware. I don't want to say that this is something that, that a person who is going through the process would do. But even for them, when you have somebody that can sneak into the system and pretend like they're either transitioning or cross-dressing, but they're really interested in children from a sexual perspective, we have to be aware of this and not blind to it, because it really does happen. And also bringing it into the school system, children don't need to know this stuff in kindergarten. They don't need to be told about it. It's not something that would enter their minds at that young of an age. This is something, if you want to bring it up as a parent and talk to your teen about it, or of course they've probably seen YouTube videos on it, but they're older and they can process it. But it's not something that children need to deal with. I think it's a little bit excessive and over the top to be teaching this in elementary school. So I did want to go over this with you today. I do have some more information on it, but I did want to alert people that this is something that can affect a person negatively, because I work with people in their 20s now that have experienced some of this in their teens, and there is a sense of confusion that some people have sexually, not confused with whether they're straight or they're gay. They're more confused with what's arousing them. They're confused if they are attracted to a body part on the opposite sex and they feel maybe feminine or masculine. You know, all of these things are put into somebody's head at an early age, and that can cause a person confusion if it is seen um, as like an everyday thing, or it's made to be normalized in a certain way because it's not normalized. This isn't what we teach children. This is how you influence a child. This is how you make them confused. And so that's the last thing that we need to do as a society is add more confusion. If a kid is having a problem, then we want to talk to them about how they feel about themselves rather than say, oh, you must be this or you must be that. Just, you know, how are you feeling inside? Why do you feel this way? What could be the reason? And, you know, the best practice is to empower your child and to make them feel good about who they are. And a lot of that starts from within, and it's not necessarily how you dress yourself on the outside, but how you feel about yourself on the inside. And that's really what we should be focusing more on. So if you like this video, please give me a thumbs up, subscribe to my channel, and I'm always open to comments. Tell me what you think about some of the things that I've said. And okay, that's it for today. As you know, I believe everyone deserves to have a healthy sex life, and so do you. Have a great day.